In the life of any surgeon, you need to start operating yourself. And in my case, that was a good introduction in terms of doing some procedures. Probably first procedures I started doing, obviously even starting with the small thing like the intravenous cannulation. But then when we talk about the surgery, the first procedures that I did, small procedures in plastic surgery. There are a lot of small procedures there, and they were very good surgeons and registrars, the Department of Plastic Surgery of Royal Hobart Hospital, and then I started doing more. And the supervision was very tight, and they looked at after my performance, but closer to the end, after doing a few, and in general surgery as well, and you start with some abscesses or excision of the skin cancers, then you do varicose veins, then hernias, so you progress as you go. And before I got even to the training in general surgery, I worked as a unaccredited registrar in plastic surgery, and by the end of the year, surgeons allowed for me to do the operations that were moderately complex with someone who, I remember operating on someone half of night who put through glass and severed pretty much all of their tendons and one of the nerves. And at that time, the feeling was that I can do this type of surgery on my own with using a microscope and stitching the median nerve and a lot of tendons and muscles. And the surgery went well, and that probably was at the top of complexity that I could do it at that time. And then 2 years of general surgery. Again, I enjoyed doing a lot of stuff. I was good from beginning, I suppose, with laparoscopes. So through 2 years of general surgery, I've done 95 laparoscopic cholecystectomies when I removed the gallbladders, and I just like that stuff. And then the next stage, and that's probably, it is more complex, is cardiac and thoracic and lung surgery, and particularly complex multi-stage operations on the heart, where you introduce slowly, you do one part of the operation, then another, then you do a couple of steps of the operation. The cardiac surgeon is always next to you, and finally it comes to the stage where you, as a primary operator, can do the surgery yourself with the surgeon, and it really does require your mentor or the senior surgeon to be with you and to dedicate his or her time into teaching you to how to do it, and then from one operation to another, and so on. And the further step is when you have to operate on your own. When I finished the training, I've done 3 years of fellowships when I worked with the other surgeons and operated either together or when they would allow for me to do surgery on my own. And then as I came back to Australia as a consultant, the very big thing is when you are you've got your colleagues, surgeons, but now no one supervises you. It took years to get to this point, but then you need to operate yourself, to do big operation on the heart or big operation on the lungs. And that's the culminative stage when you start operating yourself. Not everyone can do it, but certainly it's a very self-selecting field. There's a lot of surgical fields, and there were. Then you progress further.